Weather and traffic on the twos. Another update coming up at 7:52.
Hip-hop star Kanye West is mourning the death of his mother today. 58-year-old Donda West died Saturday after she stopped breathing at her home. The coroner's office cited a recent surgical procedure as a possible cause. According to TMZ.com, a plastic surgeon performed a tummy tuck and breast reduction surgery. Another California surgeon said he declined to perform that surgery several months ago because she had a pre-existing condition. This tragedy brings up the question, what are the risks involved with going under the knife? Dr. John Grossman, board-certified plastic surgeon, joins us live this morning to talk more about this issue. Good morning.
Good morning to you.
So let's talk first about what the pre-existing condition might have been. A lot of speculation in this case with Donda West, but what might some pre-existing conditions be that would keep you or another doctor from doing these types of surgeries?
We should just back up for one brief second and say the misconception that the public has in general is that cosmetic surgery is safe. Weekend facelifts and overnight and lunchtime peels and this and that.
We hear those things all the time.
Absolutely.
That's how they're advertised.
And that's the problem. They're advertised. That's fluff. The reality is that cosmetic surgery is surgery, real stuff. And patients do die just like any other operation. So taking it lightly from a medical perspective is a great mistake. And so we deal with Kanye West's mother, who presumably, we're told, had pre-existing conditions. Now, in reality, people with pre-existing conditions, heart disease, angina, having had a bypass, hypertension, high blood pressure, diabetes, all these things in and of themselves don't make you a non-candidate for cosmetic surgery, but they have to be in great control.
Just like any other surgery you would do, those conditions might put a little more stress on the body, so that would be a factor?
That's correct. You'd want any disease that existed prior to your surgery needs to be in good control. And so if one or another of these diseases is not, and the patient is perhaps not cooperative, not compliant, is a smoker who won't stop smoking, and a variety of things, then it wouldn't be uncommon for the plastic surgeon to decline. The other piece, of course, is we're told that she had a tummy tuck in and a breast reduction and went home. There has been a movement toward outpatient tummy tucks. But you have to take also into account the age of the patient, as we said, pre-existing conditions, and the duration of the anesthetic. The longer the anesthetic, the more other problems may occur.
Generally, though, how long is someone in the hospital when they have this type of procedure? A day or two or longer?
Well, it's not uncommon for these two procedures to be done as an outpatient. It's not necessarily the standard of care, but it's not beneath the standard of care. The problem, of course, comes in, is this patient an appropriate one to do that for? Outpatient breast reduction and tummy tuck.
Okay, one other question here. Is there an age risk? Someone said today she was in her 50s, and I thought that is typically more of a common age for someone for plastic surgery. Is there a certain age where it's a little more serious?
Every operation is serious. If the patient is healthy at 58, there's no greater risk than probably for somebody who's 48. Age is a factor because usually it involves other entities, other diseases come along with age. So while 58 is an entirely appropriate time to have the surgery, age as one of the factors in evaluating the patient is something to be kept in mind. This patient is going to have a long anesthetic and probably a general anesthetic.
Every surgery different and everyone serious, as he said. Thank you for your time this morning. We appreciate it.
You're welcome.
All right. And we'll be right back. Stay with us, 7:49 now.
Join